I consider our next guest to be a true rock star. Technically, she's a doctor and a surgeon. She is actually a renowned breast cancer surgeon. Angelina Jolie and Sheryl Crow were both her patients. She also saved a very dear friend of mine's life when she was diagnosed with breast cancer. We are so proud to welcome her here. She's the author of the new book. I think it's an essential for every woman. It's Breast, the Owner's Manual. It's every woman's guide to reducing cancer risk, making treatment choices, and optimizing outcomes. Please welcome, I love her name too, Dr. Kristi Funk. We have never met before today, but I feel like I know you because one of my closest friends in life, a woman named Britt, in her 30s was diagnosed with breast cancer, went through double mastectomies and several other surgeries, and today she is so happy and healthy and whole and with her children where she belongs.
Yes,
and her beautiful husband. And you were not their first consultation. You know, they went to you, I think, second or third.
Right.
And I asked them a couple days ago, I called them and I said, what do you want me to tell her? What can I ask her? What do you think women should know? And they said, you know, what surprised them was the first diagnosis, they were told to wait a month before beginning treatment. They went to see you. You had her in treatment immediately. They liked that you were aggressive. They liked your sense of humor. And they liked that you really try to custom treat each patient. That you customize techniques and treatments that in her case helped when she had her double mastectomy.
First of all, that is such a sweet list of compliments. Very kind. I have kind of these secret surgical weapons that I put out there and publish so other people can have them too. But it helps every woman, no matter what your shape and size, have the option to preserve all of the skin and the nipples so that after mastectomy you really feel like you inside your own skin.
So they also wanted me to make clear that just because Britt happens to be married to a very famous person as well, you don't just do this to treat celebrities. You don't only treat celebrities. You do this to make women less scared of it. And you're committed to all women, not just famous women.
Oh, of course not. And I even, you know, take Medi-Cal and all of the insurances under the sun. So it's not an elite practice by any stretch.
By any means, right.
Because all women have breasts and all women can get breast cancer. And this book is written specifically for all women. You know, it's interesting to me, even doctors, let alone just your average person, believe that the majority of breast cancer is caused by either an inherited genetic mutation like BRCA or because it just runs in my family, there's cancer everywhere. And while those are two reasons that increase your risk, 87% of all women diagnosed with breast cancer do not have a first-degree relative with breast cancer.
Do you think that that's what the book's purpose is, to break all those misconceptions?
That is the purpose. I mean, those two things, they really matter, so I don't want to downplay women whose families have been destroyed by this inherited mutation, et cetera, but for maybe up to 90% of us, we have much more control than we know. There are so many things under your influence. Every day that you make a little choice brings you closer to cancer or farther away. And this book tells you...
What are some of those choices? Make it...
Diet and nutrition, alcohol, exercise, obesity, hormone replacement therapy, emotional stress, and environmental toxicities. Things that are actionable, cheap, that you can do today are littered throughout that book.
Okay, we want to go help some of our viewers while we have the doctor and she is in. Let's go get funky over here.
Okay.
Right? Okay, Linda's our first.